بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about the useful abnormalities detected by diffusion weighted imaging sequence in the brain. I will not discuss here the basic physics of the diffusion weighted imaging sequence, but I will discuss the clinical indication and usefulness of this sequence in the brain detection of the brain abnormalities. What are the regions we can see with diffusion weighted imaging? We can see acute infarction, we can see highly cellular tumor like lymphoma, meningioma, and a primitive neuroectodermal tumor, pyogenic abscess, cholesteatoma, especially the recurrent one, mucinous adenocarcinoma, epidermoid. Also, we can use it in encephalitis, encephalomyelitis, meningioma, and multiple sclerosis, and in patients with epilepsy. And also to evaluation of the patient with contusion and traumatic axonal injury. As we said, the diffusion weighted images, it is sensitive for detection of cytotoxic edema, especially in ischemic tissue, either resulting from infarction or traumatic brain injury or other causes, or also see it in tumor with cell-rich tumor like lymphoma, epidermoid, meningioma, etc. And when we see the diffusion weighted imaging, we should also look for ADC map, and we can, if it is the diffusion, it is hyperintense, and the ADC map, it is hypointense, it is a restricted diffusion weighted imaging. Let us see some examples of the usefulness of the diffusion weighted imaging. Here, this is a brain tissue, this is brain trauma, and we see here in the brain CT scan in the axial cut, there is hemorrhage in the region of the splenium of the corpus callosum with diffusion weighted images, and a DC map, there is a restriction of the whole area of the splenium of the corpus callosum, and this is indicating that the patient has an injury to traumatic injury, axonal injury in the splenium of the corpus callosum. Here another patient with trauma, and we see here in the brain CT scan, patient has edema, but in the diffusion weighted imaging, We see extensive axonal injury involving the corpus callosum here, indicating a restriction, and also in the parasagittal gray-white matter junction bilaterally. And this is hypointense in the ADC map. Here, we see patient with non-accidental trauma, and we see the restriction in the corpus callosum, and also in the parieto-occipital region, and this is indicating that the patient has cytotoxic edema in that region and involving the right parietal area here, white matter indicating the contusion in that area due to non-accidental trauma. Here, this is patient with acute infarction, and we see here there is hyperintense area in the territory of the middle cerebral artery, and in the diffusion and restricting. It is restriction with diffusion, indicating that this is acute infarction. Here is another patient with, on the left side, there is restriction due to cytotoxic edema of the infarction, and this is in the territory of the middle cerebral artery, indicating acute infarction. Here, this is another patient with diffusion, with restricted diffusion in the territory of middle cerebral artery with indicating acute infarction. Here, this is another patient. We have cystic area in the right CB angle, and with diffusion it is restricted, and this is a classic for epidermoid. Here, this is another patient with ring enhancement surrounding by edema in patient following transplant, and on the diffusion weighted images it is restricted and it is consistent with an abscess. This is another patient with cerebral aspergillosis with multiple lesions, and here we see lesion and another lesion here, and that lesion is heterogeneous in the diffusion weighted images, and it is homogeneous in the diffusion weighted imaging. With contrast, it is with enhancement, ring enhancement, consistent with an abscess. Another patient with fungal abscess, and we see it here in the diffusion weighted images. Here, another patient with an abscess with restricted diffusion with ring enhancement and necrotic material here. Another patient with abscess with ring enhancement and restricted diffusion in this patient, and this is an abscess. Here, this is a patient with ring enhancement, irregular ring enhancement with surrounding edema and restricted diffusion, and with perfusion there is and the periphery of the lesion, indicating that metastasis. This patient with meningioma, a large heterogeneous enhanced mass in the left frontal region with mass effect, with restricted diffusion, and ADC map is hypointense and with elevated blood volume, and this is meningioma. And this patient has high signal intensity mass lesion with peritumoral edema. This is T2 and enhancing and restricted diffusion with increased vascularity or diffusion, and this is lymphoma. And this patient has low-grade glioma. You see here mass lesion, non-enhancing with iso-intense on diffusion, and there is no vascularity in the perfusion, and with no significant perfusion, this is due to low-grade glioma. Here, this patient with anaplastic astrocytoma, and we see increased signal intensity with peritumoral edema with heterogeneous enhancement, with restricted diffusion of the solid material and increased perfusion, and this is anaplastic astrocytoma. Here, this is another patient with glioblastoma multiforme, and we see here mass in the temporal region, right side, with irregular ring enhancement with surrounding vasogenic edema, and we have a restricted diffusion in this and increased vascularity of the mass, reflecting tumor infiltration in the surrounding parenchyma, and this is indicating malignant tumor, glioblastoma multiforme. Diffusion-weighted imaging is useful in differentiating between the fibrous tissue and the granulation tissue following operation of cholesteatoma. That granulation tissue is usually enhancing and there is no restriction, but in a recurrent or residual cholesteatoma there is restricted diffusion. As we see here in this patient has enhancing granulation inflammatory tissue in the surgical bed of the cholesteatoma, and there is here restricted diffusion and non-enhancing area, or restricted diffusion of the non-enhancing area, indicating that it is a recurrent cholesteatoma. And this patient also, there is soft tissue non-enhancing in the surgical bed of the right ear, and this is a restricted diffusion and diffusion weighted imaging, and indicating that it is a recurrent cholesteatoma. Thank you for very much for listening. Hoping to see you soon in another talk.